introduce or welcome our speaker for today, our number one, our favorites. Yes, Dr. Wale Babs Fashola, please. A round of applause for him. Keep going, keep going, keep going, keep going. Woo! We celebrate you, sir.
Hallelujah. You know, when I was walking in, and I saw a lot of women in this place, the picture that came to me were the pregnant women that I used to see in Atlanta. So I was tempted to be walking like this. Doctor. Hey. Hey. Is this doctor even around, safe? Say, doctor, it's a Denny. He's inside. What's a gaffon? Oh, my one really want it down. Doctor. Who's that? Please come in. Doctor, it's me. Oh. We are here. What's the problem? Doctor, I've told you before. Why is it that it's only we women that we have to go through contraception? Why can't our husbands to do contraception? This is real, though. I'm telling you, a real life drama situation. She's had 3 children, and she's had another one, and she was going through a turbulent time. And for her, it was a major, major issue because, number one, she wanted to satisfy her husband, and then she also wanted to make decisions for herself. She had told herself she would stop at number 4, but unfortunately, this was number 5. So the question she was asking, and she was very serious, Doctor, why are men not doing family planning? Why don't they have contraceptives for men? Now, the thing is that the person he's talking to is a man. So I had to ask myself, that's true. Is there any contraceptive for man? Good evening, everyone. Let's put our hands together for ourselves again. It's awesome to be here. I know the last session we had was online, and it was a very, very insightful session because apart from that, I had a lot of people who came up to ask a lot of questions. And we're not able to finish and trash out a lot of questions. And today, we'll leave no stone unturned to be able to answer those yearnings and those questions in your heart. So I want to implore us this evening, please be free. We're in the church, but we are free. You can see that my wife deliberately picked this clothes for me. So I should not wear any streets, what's it called? Serious looking, it should be fly and look so that I will not look like as if we're a church, so that I can be free. So I'm here tonight for questions. We're going to talk about a lot of things, and I want us to be real. I want us to be direct, okay? And I want us to be blunt. I want us to be what? Hallelujah. So, without wasting much time, there are 3 or 4 things I have prepared for us before we go straight into the question and answer sessions. The first one is fertility. Fertility is very important. This is just a combination of factors that make a woman the ability for her to be able to conceive. And that's what I always ask. This one concerns both singles. Are singles in the house? Yes. They want to know. Some of them are even apprehensive. Am I fertile? How do I know I am what? Fertile. Are there signs that can tell me that I am fertile and ready so that when my partner comes, I'll be confident to be sure and know that I can give birth when time comes? Is that not so? And then we have those who have gone through marriage and they are also settled. And they are also saying, look, I've had one, but doctor, somewhere in between the line, number 2 has not come. It's 6 years now. We are still waiting. What can be the problem? Is it that I'm not doing what I ought to do? So we have that to be answered here also. And then we have those who have never had, despite they've been married, and those signs have been there that shows that they can get pregnant. But the baby is not coming. The baby is not coming. And then we have those who they've been through a lot of medical conditions, and one way or the other, they've been having miscarriages. So they don't know why they're having those miscarriages. Pregnancy is coming, but pregnancy is not staying. So today, we're going to look at all those, and then, of course, we'll also talk about contraception and perimenopausal and menopausal period. Hallelujah. Look at the person beside you and say, are you glad to be in the house? So quickly now, fertility, for the singles that are listening, is your ability to conceive. Now, from what we have done and research, we have realized that contrary to what people think, that women are the sole reason why pregnancy failure occurs. That's not true. That's not what? That's not true. It's been proven that 33% of the time, factors surrounding women is responsible for their inability to conceive. It has also been shown that 33% of those factors also lies with men. All right? And then the last 33% is for both of them, where they are combined factors. There's a problem with the woman, and there's a problem with the what? With the man. So in other words, it's 1/3 each. And for a woman, it's very important you understand yourself. Please, can we put the first slide in? This structure is the reproductive system. I just put it up there so that we can have a basic understanding, all right, of the female anatomy. This is not biology class, but it helps us. If there's going to be any problem, all right, everything about a woman is centered around a menstrual cycle. A menstrual what? From the time she begins to see changes in her body, puberty, till the time she has her first menstrual flow, okay, that has been set. There is a timer that has been set. Because for a woman, all the eggs that, you can see that structure called ovary, that one hanging down, all right, that ovary, the white one there. Oh, I wish I could have to point it. That's where all the eggs are stored. Up to 2,000, stored already. So from the age of 12 or 15 that she starts her menstrual flow, she begins to drop one egg every month for the rest of every year. So invariably, that's 12 what? 12 eggs a year. That's if she has one every year. So if you remove 12 from 2,000, it goes down. Abi, by the time she's 13, another 12 goes. By the time she's 14, another 12 goes. And then it continues to decrease. So by the time she's getting to the age of 35 and 40, that count drops significantly. Are you listening to me? So one of the major factors that affect a woman and her fertility is her age. Somebody say age. Age is very important because the longer you are, okay, the younger you are, the more the tendency that your eggs are still strong and viable. The older that you are, what happens? It begins to decline. Do you understand? You get that? So, and in that ovary, there are a lot of factors that allow those eggs to grow so that once they grow to maturity, they are able to be released. So the second factor is the release of that egg into that tube. You see that thing that looks like yeah, that's the tube. That's the fallopian tube. We have two. Women have two. So the eggs are released into the tube, waiting for what? The sperm. Good. So if there's a problem with the tube, that's the second factor. If there's a problem with the tubes, what problem do you think can happen with the tubes? Oh, these people are brilliant. If there's a blockage, if anything blocks that tube, in fact, I call it the rate limiting step. What's rate limiting step? The rate limiting step is the part of a process that you can come through number 4, you can get number 3, you can get number 4. If that process is not there, all the other process cannot work. So what am I saying? If the eggs are fine, okay, and the sperm is good, and the womb is fine, but the tube is blocked, what will happen? Nothing will happen. Thank you. So the tubes are very important. Then the third one is the tube. Can you see that fundus, that inside, that red one? That's where the baby comes in. When there's a fertilization, then there's implantation. It stays in. The inner lining of the uterus is where, when the pregnancy doesn't occur, it begins to fall out. Okay? It sheds that inner lining. I'm going to say something about that, and it's very important. That inner lining that excels the uterus, that lining comes out through the cervix as blood. That's what we see as menstrual flow for 3 to 4 to 5 days, or some people even 7 days. All right? The normal flow should be 2 to 8 days. So if you have 3 days flow, it's fine. If you have 4 days flow, it's fine. But if it's more than 8 days, then there's a problem. If it's less than 2 days, then there's a problem. Are we getting it? So the next one is the womb. Anything that affects the womb also, maybe it's abnormal, it's supposed to be 1, you have 2, or there are certain things that are inside of the womb that are not allowing the baby to stay in, then we could have a problem. And those things like fibroids come in, polyps come in, all right? Endometriosis come in, adenomyosis come in. You may not know that, but it's okay. And then the last part is the cervix. That's the entrance through the sperm will pass through. Now, you people underrate that cervix. That cervix is the small opening at the womb, at the mouth of the uterus. That cervix produces what we call mucus. Some people, we've done all the investigations for them, the ladies. Their womb is fine. Their eggs are fine. Their tubes are fine. The hormone profile also is fine. But we realize that every time the man releases, she produces the cervical mucus that is very, very what? Very, very what? Not harmful, that is resistant to the sperm. So it kills it. It kills it. So someone like that, it may just be the cervical mucus that's the problem. Just keeps killing it because there are certain antibodies that are inside of it that attacks the sperm and sees the sperm as a foreign what? It's protecting itself. So someone like that now, we need to now start giving drugs to make that calm down. So I'm just trying to make you understand that along the line of this tube, if any of these processes is interrupted, there will be a problem with fertility. So normally, the menstrual flow you see every day is one of the signs that you are fine. What do I say? Menstrual flow simply means that pregnancy did not occur. You understand? Because if pregnancy occurs, you won't find it. But there are other instances where pregnancy does not occur and it doesn't come. Then there's a problem. Do you understand? Do you understand? So we're here to learn. I talked about age. I talked about menstrual irregularity. So when your menses is fluctuating, you don't see your menses. Maybe one day it goes on sabbatical. It comes again, maybe in the middle after you've seen it. A week after you see it in the middle again. That's intermenstrual flow. Then there's a problem. That is what we call hormone imbalance. A lot of things that can affect it from the brain. One of them is stress. One of them is what? A woman that is stressed. I'm telling you, stress can make a woman not even see her period at all. It can make her period reduce. It can make her lose weight and invariably cause infertility. Lifestyle and environment. You know, when you get to a place and you begin to take, this one is a shawarma. Let's eat shawarma. Let's eat, there are certain foods that when you eat them, they build calories in you. What now happens? Yeah, it stops or prevents the hormone that is responsible for producing, thank you, ma'am, for producing what? Eggs. That's what we don't know. A lot of young people now, we eat all sorts of assorted. It's not wrong to eat it, but you have to be careful. For those who want to get pregnant, there are certain things they are deliberate about their diet. About their what? Diet. We've heard of PCOS. It's no longer PCOS now, it's PMOS. Somebody is correct. It's PMOS now. It's called polyendocrine metabolic ovarian syndrome. Polyendocrine metabolic ovarian syndrome. And the reason calories are retained in the body, and because it's retained in the body, they begin to form the male hormone. Do you know you have male hormone in your body? Men have female hormone. But the numbers are not significant. For women, the male hormone is not much, and the female hormone is not much in men. Do you understand? But when the calories come in, then there will be an imbalance. Because you are taking more, your body is not burning it, all right? You begin to have truncal obesity. That's one of the ways we know. When this inside part is coming out, okay, all right, and the face is puffing out, and these sides are coming out, okay, and you're having fat on here, that it's one of the signs. In fact, we can diagnose it 98% of the time when we see the patient. So we know that it's classical PCOS, and that's because calorie. And you know, when you gain weight, it's difficult for you to burn it, right? 80% of the time when you lose weight, your menstrual flow comes back. Everything falls back to normal. That's a fact. All right? So that PCOS is a lot of things. You could have body hair. They start having body hair, facial hair. Do you understand what I'm saying now? Have body hair, they start having body hair, facial hair. Do you understand what I'm saying now? Because their body is not producing male hormone, and male hormone will not allow your eggs to grow. It won't let it grow. So we need to use a lot of treatment. Usually it's difficult, but it takes time, but it can be treated. It can be what? Treated. The other things I want to talk about, I've talked about uterine and cervical cancer. I've talked about endometriosis. This one is even dangerous. Endometriosis is when that inner lining of that uterus, where the menstrual flow comes from, that inner lining now is found every other place other than inside. When you find that inner lining in the ovary, you find it in the chest, you find it in the gut. So every month, because that lining is sensitive to producing blood, menstrual flow is responsible, is sensitive to estrogen, the hormones. Anywhere it is found, once that period comes, she begins to see blood. So imagine if that inner lining is in the ovary, where the eggs are stored. If she starts to what? Menstruate in the ovaries. And what will happen? It will affect the eggs. Won't it affect the eggs? It will affect the eggs. The eggs become useless. If it's in the gut, she starts having chronic pain. You know what I'm talking about, chronic pain? In the gut. That's why most of them, when they have it, they usually have pain that does not resolve with paracetamol or conventional, analgesics. Serious pain that it does not even allow them to walk. I had a woman who works in the flight attendant. She almost lost her job because for 3 months, she was always taking sick leave. She had endometriosis. She was about 29 or so, and she needed a medical report to save her career. Initially, they thought she was malingering. Maybe she was faking it. But when we saw her investigate, we found out that it was endometriosis. Every area of our body, when we did the hysteroscopy, we found out that it was everywhere. And most times when we do surgery too, we see those deposits on the tube. It's just that I couldn't get those pictures, and I needed to take permission from the patients before I put it up. So I couldn't put, I'm talking a real live one. I have to take permission before I put it up so that you can see it. So anywhere it is, the problem with that endometriosis is that when they bleed, any structure around them, because they are scar tissues, they form scar. You know scar? So everything around them begin to glom together. Begin to do what? Glom together. So if they find the tube, if it's on the tube, what will happen? It will make the tube to be obstructed, right? If it's in the gut, it clumps two together, causing severe pain. Most of those times, their treatment is usually not 100%. Those patients, at the end of the day, end up we have to remove the womb to give them relief. We usually give them a lot of drugs, goserelin, things that reduce the the effect on the endometrial lining. But at the end of the day, that will take them to 3 months, 4 months. After a while, it will come back. So then I've talked of fallopian tube blockage. Then anovulatory cycle. Some people may be seeing their period, but they are not releasing eggs. Good. One of them is PMOS that we talked about. Because in PMOS, because the tubes are not growing, they are formed more male hormones, the tubes are immature. So they won't release, the eggs won't grow. The endometrial lining will not grow because those eggs, when they are growing, they tell the womb to start preparing. They begin to grow. Blood vessels go there. But when there are no blood vessels, there won't be any menstrual flow. So they don't have menstrual flow, or they have very little. Very, very little. So they may not see their period. And they will not release eggs. Another one is thyroid function. Have you seen someone who have swelling in the front of their neck? Goiter. Yeah, goiter. Goiter is very significant because any woman who has goiter, swelling in the neck, they call it in Yoruba, where's Mrs. Fumi? Belu, gege, what do you call it? Baby, gege. I think it's gege. It's gege. Swelling like that. There's a small thyroid mass in front of, we call it Adam's apple. It controls the metabolic rate in your body, even your eggs, how your eggs are being released, how they are being formed. Once there is deficiency or a problem with the thyroid, that woman may have, you may not even know. So sometimes everything is fine, it's just that thyroid that is a problem. But when we treat that thyroid, it returns to normal. So she may not even release eggs with that. And then the last one also on that is hyperprolactinemia, a condition where the woman is not pregnant, she's not breastfeeding, but she's seeing milk. There's so many ladies that will just come and feel ashamed and embarrassed and come to the office and say, doctor, I'm seeing milk discharge from my breast. They are worried. What's going on? And then when we investigate, we do tests, we realize that it's prolactin. Sometimes it may even be more We have to be sure that it's not the ones from the brain that we call them prolactinomas, the ones that cause cancer. So we have to investigate them. And then when we find out it's those, not those ones, we start treating them. If you have those high levels, it's difficult for eggs to grow. So those are just one of the causes. There are male factors. I know our husbands are not here. It's not just a woman. It takes two to do what? For the men, because the men are not here, I'll let that go. But you may need to know also. Your partner, you need to be sure. Has he had any surgery done recently? Hernia? Men who have had hernia done is most likely going to, if it's not properly done, can affect the nerve that supplies the testes. Men who like to have hot baths. I know people say, honey, you are smelling. You just came back from work. Look, go and shower. How many people like your husband to go out, your boyfriend or to go and be shower? I know women like it. Hey, go and shower. Oh, you are smelling. Hot baths. Oh, yeah, now see how you're looking at me as if, but you like it now. You should have hot, Abby? Because most women shower immediately after they come, which is good. It's hygienic. But hot bath, sauna, the ones that they go in, it's not good for a man. Because the testes of a man that produces the sperm, the reason why God put the testes outside of the body is temperature. You've not wondered, it's hanging out. I'm talking of the two balls, the testis that is hanging out. Yes. That's where the sperm is produced. These people are doing church. Pastor Faye. They don't understand. You will. So the body temperature is not good for the testes. That's why God put it outside, though. So there are some men that are at risk. I'm giving you a original now. Men that drive a lot. Why? They are sitting down all the time. You know, if you sit down and you stand up after a while, you feel warm and moisture, heat. Yes. The testes, they are sitting on it and then heat. And so it will affect him. Smile now. These people, they are too serious. It's like these people are too serious. Please smile. Are we here? Hello? Our mothers are looking at me. Is this the song weary? Please, when you shower at night, that's why you should go and see Sister Faith. Buy nightgown that is free. Nightgown that is free. My wife is buying it, so it's free. Hey, Ale Wole, you will see that it will eliminate odor and then for proper functioning of that system. Top notch. So the men do the same thing. No? Don't wear anything, no boxer at night. Let it be free. Okay? That's original. Then the other one also, are we still here? That one is more advanced. They need to see doctors. Many of them will have problem with erection. I'm just saying it because it's not everybody who wants to talk about this. These are things that we'll not be able to talk publicly here. They're having problem with erection. They can't maintain erection. That's a serious issue. So when the woman comes in and they start telling me, we've married for 4 years, we have not had children, the first thing I ask, we go to the basis. How often do you people meet? And the reason we're asking is because we're in the church. Husbands and wives in the church don't talk about it. The only way you can have children is having frequent intercourse. Is that not so? And not just having frequent intercourse, but having it during the time we call your fertile period. There's something we call the fertile period or your ovulation period. Most likely, 14 days in a 28-day cycle before the next period, not after. What I'm saying is that if I see my period now, are we listening? And I count 14 days after, I'm going to be wrong. There's a high tendency I may miss that fertile period. Are we listening? So some people say after 7 days, our mothers, they count 7 days after period. Oh yeah, safe period. Why they are saying safe period? Because they know that if they pass that period, they will what? They may get pregnant. And that's one of the natural means of contraception I'm going to talk about when we get there. That it is not reliable at all. Reliable rara. You understand? So it's usually 14 days before a new period. Because that luteal phase is more fixed. What I'm saying is that if I see my period, February 1, and I have a 28-day cycle, my next period should be February 29, if it's a leap year. Abi? If it's not a leap year, it should be March 1st, right? So March 1st, I should see my new period. So if I'm going to find out my ovulation period or the time in which I'm most likely going to release egg, it's going to be 14 days backward from March 1st or from 29. Do you understand what I'm trying to say? So if I count 14 days backward, if it's a 28-day cycle, it will be 14th of February. So that 14th of February and 2 days before. 2 days before. So that's 12, 13. That is a fertile window period. Because if your partner or your husband meets you on the 12th, the beauty is that the man's sperm can stay in the body for more than 3 to 5 days. Oh, Mama Duroni. Powerful. The way God did it. It will wait. It has energy. It will wait. So if you have intercourse on the 12th, 13th, and you ovulate on the 14th, you'll be shocked that there are soldiers already waiting for that egg. Oh baby. Oh Malicha. Oh yeah, come. We are here with the bride price. Do you understand? But the chances decline when it now gets to 15 and 16. Why? Because the egg can only stay for a day. Within 12 to 24 hours. Oh, Brima Shakogon. Sheshamo. Our price are our. we are not very common, so we don't like to show ourselves too much. 12 to what? 24 hours. And from that 14 to 15, the egg is gone. So if you eat intercourse at 15, most likely you won't get pregnant. So most people, the reason why they are not getting pregnant is because they don't even know their fertile period. Because if they know that fertile period and they calculate it, they'll get pregnant during that time. Do you understand? I want to be fast. But be writing your questions down if you have any, if anything. So I was trying to bring out something from there. I was talking about safe period. Very important. That safe period is important because once you miss that period, okay, and a lot of people say that is the time, that they want to have. It's very important you don't miss it. Then we talk about hormone imbalance. I've talked about that. There's varicocele, genetic disorder, infection on both sides now, for both women and men. For women, it's dangerous because it can block the tubes. Infection that is not treated properly, that you don't see a doctor to run lab tests for you. Not all these underlay hospital that say it's typhoid and it's staphylococcus. Everything is staphylococcus. Everything is staphylococcus. Staphylococcus is normal. Please, staphylococcus is what? It's a normal flora of the skin. The vagina has stuff around. So if they don't collect it properly, you will have contaminants. Do you understand what I'm trying to say? If she's having a period and you do it there, it will be contaminated. Do you understand? So there are things we need to understand. Not everybody will know that. All right? But there are serious infections that can affect the tubes, like gonorrhea, like chlamydia. Okay? Those ones are very, very important. When you start seeing abnormal discharge, foul smelling, greenish, yellowish, not the one before your ovulation. You get what I'm saying now? The one at ovulation is like, hey, that draw soap you used to make. White, slimy, Abby? Non-smelly, does not itch. That's normal during ovulation. It is even one of those signs that make you know that you are normal. When you are seeing it, you know that you are about to ovulate. Some women have pain in the middle of their, they just find sharp pain. Let just come, bam. This month it will be this side. The next month, the other side. Why? Because nature does it, it alternates it. If this one, the right ovary, produces egg this month, the other one produces the one the next time. So they have middle pain. That's the second one. The third one is what? Breast tenderness. They just feel that, my breast is full. Okay? Slightly tender. Okay? That's okay. So it's also a sign. Then the less obvious one is temperature rise. They feel as if they are warm. And during that period, they feel giddy. They are in the good mode. When your wife starts giving you signs, oh baby, she start walking as if, start bending down as if, what's going on? So this is the time for the man to go and pray. Abi? You should go and pray. Play with yourself. He won't go and pray, Gogo. All right, so let's go back. So are there treatments for singles, like I always say? You don't have to wait. Once you notice menstrual irregularities, it's a good time for you to come to the hospital. Let the gynae check you. You understand? You see all those signs I'm talking about. You're seeing milky discharge. Let the gynae check you. All right? You see those signs that you're adding weight. You are seeing those. Let the gynae check you. All right? Very, very important. So let's move on to contraception. Are we okay? You can write your questions down on fertility stuff. There's so many things we can discuss on that, but I just want to move on to the next one. So contraception. The contraception word is gotten from the word contrary and conception. Contrary is opposite or against. Conception is ability to conceive. So if you merge it together, we have contraception against conception, against pregnancy. Do you understand? So what we are talking about is a situation where a woman doesn't want to get pregnant. She knows she's at risk, that if she's going to have intercourse, she most likely will get pregnant, and she does not want it. How many of us are in that situation? Okay. So I move on. Everywhere is quiet now. Now, I said contraception can be a device, a medication, a procedure, or behavior. What did I say again? Let's say it together. A device, a medication, a procedure, or a what? A behavior. And I'm going to break it down. So we want to talk about how can we prevent pregnancy. The earliest our mothers used to do is the natural one. How many of us know the natural one? The natural one is what I talk about, the calendar method. They just know their period. They know it's 28 days. They know it's 27 days. And they time it. They now tell the husband, this is the time you can come. Don't come in now. You understand? Now, that is the earliest and the most simplest and the most basic. Now, if you ask me, how effective is it? Oh, yeah, talk. I just want to hear feedback. How effective is it? Calendar method, and you've heard withdrawal method too. Withdrawal, when you rely on the man. How dangerous, gone. Somebody say, Mr. Kokwala is laughing. How dangerous, gone. Withdrawal method. You say, my husband is a pastor. I trust him. Oh, yeah, he will not withdraw. It will be. You will just hear, but baby, oh my pain now. So we shanu me oh more. My bino now. Oh yeah, go. And then you get pregnant. Hallelujah. So the earliest and the most simple one, and that's what we talk about behavior. Okay? Behavior are the things we do personally to prevent us from getting pregnant. We've heard those things now that people drink all sorts, caustic soda, lime, limca. I'm here to debunk myth. When I was in school, university, I see young ladies too. We don't know what they are doing. I call them, they will go and carry limca. They will carry 7, no, is this 7-Up or Sprite? They shall have one that they think, Crest. It's Crest. How many of us know Crest? Crest. With one, there's one herb too that they used to put. Also, where herb, and also where lime. Lime. Please don't, everybody, you are free to talk here. Oh. I'm telling you controversies that happen. Atikon, God bless you, man. She's going to be one of the people that will get a prize. See, if you answer questions right here, I've discussed with Mrs. Babs. I like encouraging people. So she will get a gift. She's one of the people that get gift. One real people here. Okay, so when I was smashed, I see some of my guys, they were drinking Crest. One man Crest, so I'm one kilo share. We did not know at an alabokun. Yes. So behavior, because they believe that when they take it, it has a way of stopping or removing or terminating a pregnancy that is not wanted. And there are many reasons why we have to talk about contraception. One of them is preventing unwanted what? Unwanted pregnancy. I believe we are talking to a group of people that are matured. So I understand that this discussion is educative, insightful, but we also have to play it based on our understanding of what God wants. Or what? Hallelujah. So that's the natural one. I said what? 4 ways. A what? The first one is what? A device, a medication, a procedure, and behavior. So the first one we have talked about, I'm watching people, so I know you are listening. Okay? All right, so we talked about that behavior, the natural one. Now let's talk about the other ones. So we know that we have hormonal barrier methods. The next one is barrier methods. That's the next one. Barrier is just that, bro, a man wants to enter that place now, but there's a door. If it doesn't have if it's locked, can he go in? So he doesn't have access. So barrier is just like there's no access. You can see this home now. That's the vagina. Barrier methods just say that there are things that you can use that limit or prevent sperm from entering. You are saying it already. Preventing from entering to the egg. You don't want it to get to the egg. So can anybody tell us any barrier method you know? No. This one will collect all the money. I said, can you mention one barrier method you know? She said what? Condom. Now there are two types of condom. Can we put on the second one? We have female condom and we have male condom. Good. But how many of us have used the female condom before? I'm talking to married women now. It's stressful. All right, good. Thank you. That's one of the pros and the cons. We are going to see the pros and the cons. What are the advantages of these methods? Why one is better than the other and why people prefer one to the other. All right. It's not too sharp. I tried to make it big. Can we make it a bit bigger? So that's the condom there. Barrier methods, the green part, the lemon green part. You can see that's the male condom. The one by the side, the one by the side is the female one. Can you see it? And the beauty of the male condom is that this one is worn by the man. The male condom is the most common one that we use. The man wears it, okay? And what it does is that, thank you. So let's look at the green one. Can you see barrier method? That's the male condom. You can see the one on top that has like a tip, like a cap. A cap. That's very important. That cap there is very important. It's not designed. The reason is because if that tip is not there, if there's no space or allowance from that tip, okay, then the risk of it failing is high. Do you understand? Do you understand? So what I'm going to talk about barrier method is that for the male condom, which is commonly used, but if it's not effectively used or properly used, okay, the tendency for it to be what? To cause pregnancy is high. It can break. You can see it's like a rubber. It's like a rubber sheet, one, so that what? Sperm can be contained. That's what it means. Now, if you wear that condom completely and the tip is not there, what will happen? You know, when the man releases, there's no space to collect. Is that tip that will collect the 3 mils or the 2 mils of sperm that is there. So if there's no space, there will be problem. There will be pressure. So it can spill out too. The size of the condom too is important. You are wearing a small size, you will be shocked. That by the time you are pulling out, the condom has entered, it's stuck inside the vagina. And all the sperm is in there. You understand? So what am I trying to tell you? Condom is not reliable. In fact, they say with typical use, that's what we call typical and proper use. If the person uses it the way they asked them to use it, the likelihood of it being effective is just 87%. It's just what? 87%. Condoms can break, depending on the size, depending on the quality, depending on the pressure. Thank you. And then some people make it worse again. They now go and use lubricants. Please, we are learning here. Are we learning? Okay. They now go and use lubricants again. Oil-based lubricants. They're not good at all. Oil-based lubricants. Vaseline. Go da-da-da. You go and put it again and say you want to. What will happen is that you will render, and faith is frowning. Did I say something wrong? If you use the Vaseline and the oil base, what will happen is that it will interfere with the what? With mechanism and the fabric. And what will happen? It will tear. In fact, they say there will be micro. You know, you can't see it. When I mean micro is very, very small holes will be in. And before you know it, see, if you give sperm just small chance to pass. I will tell you a story and you tell me, doctor, how? I will tell you a story, you tell how. There was a young lady that came to our office. The mother came and, she was just forming. She didn't say anything. The mother said, our child cannot be pregnant. We just said, my guy and I, we looked at ourselves with sperm. Everybody in their presence of their mother is a saint. Until we sent the mother away. Mommy, Ejo, about Rosita. And the mom went outside and we brought her in and said, nobody's here. Do you see your mommy here? He said, nobody. Are we your mommy? He said, we are not your mommy. We don't judge. What did you do? He said, he went, the boy promised. He said, it's the tip. He will not share. And what happened? And he released. And when did he release? He said outside. As I wait, he said outside, just outside. Outside of the lip of the vagina. Okay. And he cleaned it. I said, okay, what now happened? She now got pregnant. Ha. I said, doctor, is it possible? I said, it's possible. You see, you see the sperm, but it's God that made that sperm. That sperm is not just a sperm. It's a life. It's like you've heard of virus. Have you heard of virus before? Have anybody seen virus before? Human being, the virus, so it cannot live outside the body. But if you put it inside, if it finds it will look for a medium. Hold him long here. The sperm, if I had the visual, is like, tadpoles. You know tadpoles? Those small frog-like that have tails. They swim. And they have a chemical in them that helps them to locate. It's like when they smell the egg. It's like ants now. You know ants in your house. How do you know where ants? When you put things sugar here, don't ants go and do you tell ants that you have put bread here? Put bread there or sugar. Within some few minutes, what will happen? The house will be there. They call them like pheromones, like a chemical that is released. They have it. So they go in. So even if it's on the surface, I see a lot of women who come to the hospital and say, I'm not getting pregnant because when my husband release is coming out. I say, that's not the reason. If your husband has released and put it inside, of course, because it's semen, there will be the watery part. But I can guarantee you that the sperm itself, if it's normal, Otiwole. Clap for men now. Oh, sorry, it's women. So she now had to confess, and we laughed and say, Ma, you are pregnant. Of course. Oh, please help me clap for Bro Emmanuel. That's that part now. That's it. These guys, they can be up to 250 million in 1 meal. You know what a 1 meal is? When you bring water, and you drop it, just 2-3 drops is 1 meal. And a normal ejaculate could be up to 5 meals. Not more, just 5 meals. You know your teaspoon, when you say take teaspoon is even too much, but that's 10 meals. Okay? Just that 5 meals, 1 meal can have as much as up to 150 million. Times 5 million. They will be boom. It's like a race for survival. Because many of them will die before they get there. Do you get? It takes them 6 hours to travel that journey. It's like me going here now to Kogi or going to Ekiti. So many of them will die. But God has put all the things they need. Mitochondria to give them energy. Fructose to give them sugar. So till their store is empty, they will keep moving. So don't underestimate. Barrier method alone is not enough. What did I say? So those of you that say, nine, do gently, Sha. Nine, I trust you. Nine will give you twins. All right, let's go on. So that's the male. The female is not well talked about because you need to place it in. Because it has the shape of the vagina. And you have to place it. So if it's not correctly, the problem with that one is that if he sleeps during thrusting, if he sleeps, then sperm can go in. So you might need a trained midwife or someone in the hospital to be able to help you put it. Okay? And that one is inconvenient. Can you see the disadvantage already? You want to have it that course, you're already planning in your head. A woman is spontaneous now. You have to go and say, oh, yeah, put this before you now go home. So you can see that it's not popular. It's not popular. Let's move on. We also have diaphragm and cervical caps. Diaphragm and cervical caps, those ones just mean that part. Go back to the uterus. That part, that entrance to the womb, that cap fits in. Yes. That entrance, can you see that cervix, that lower part? The cap is just like this. You just put it in. After the vagina, just put it there. Okay? It has to be placed into. So all these ones too are there, and their efficiency rates are low. The most talked about is the male condom because of spousal agreement. So 87% is the effective, how effective it is if it's properly used. If it's not properly used, then you know it to be even less. Which other one? We have talked about barrier. Which other one do we know? Now, the pro and the advantage of the barrier method. Can somebody tell me what is the advantage now? We've said this is advantage. It's easily accessible. That's an advantage. You can easily buy it. It's cheap. Have you? Yes, you can easily find it. For the male condom, you can wear it. It doesn't cost anything. And what else? What's its advantage? What other advantage? I'm looking for one advantage. It is, if nobody gets it, this is another gift too, if they get it. Sean, check internet. The advantage is dual protection. Dual what? For what? STDs. Clap for Mrs. Bobola. So it's about the only one that can also stop you from catching an infection. Chemo. Okay, these women are, let me tell them because they are my church people. See, there are infections that are dangerous now. One of the most dangerous infections that we don't want for a lady is the one that can cause cervical cancer. How many of you have heard of cervical cancer? I know in this church we have done that training or screening before. Now, that virus can stay in the body of a man or the penis, and it doesn't affect the man, but it can transfer it to the woman. Yeah, through intercourse. So with condom, you can actually, it's a barrier. Do you understand? So you stop infection. You also stop what? STIs, like gonorrhea that I talked about. Syphilis, very dangerous. Syphilis is not just dangerous to you, it's also dangerous to your baby. Because if a baby catches syphilis, we call it congenital syphilis. Takes away their memory, they don't have a brain, their eyes affect everyone you don't want to know. So that's why even when a woman comes for antenatal, we always screen them for syphilis. That's number one. We screen them naturally. So it is the one and only one that can prevent STD. Did you understand that? Let's move on, and I'm going to be very fast now. The other ones are the hormonal ones. The hormonal ones means they have chemicals. Those hormones are very strong. They work by the effect of the hormones. Birth control pills, that's common. How many of you seen the pills? How many of you have heard the pills? Pills, our mothers used to use it too. They call it everyday pill. We have mini pills and we have everyday pills. Mini pills means they have only one particular type. The everyday pills means they have two types of the chemicals that work at once. And what do? They simply prevent, they alter your ovulation. They prevent the egg from being released. That's what they do. That's what they what? They do. Now, we are going to get to the myths of contraception. Because a lot of people, we are already shaking our head because there are a lot of myths that, why will I be using contraception? There are a lot of problems with it. No. Now, the efficiency of this is about 93%. What did I say? If it is used correctly. This pill now is every day. You must take it every day. Who can tell me the disadvantage now of this pill? If you forget, you are a workaholic person, you need to go very early out, and somehow you missed one, and there's intercourse, there can be pregnancy. Do you understand? So if it's correctly used, it's up to 93%. If it's not correctly used, it can reduce. Then we also have the contraceptive injection. That's the 3-monthly injection. How many ever heard about that? Depo-Provera. Yes, 3-monthly. That's also very common to use. And because I see a lot of young people who want short-term spacing. When I say short-term spacing, okay, they don't want to have pregnancy immediately. They still want to resume in 2 years or maybe a year or 3 years. So they go for that every 3 months. And that 3 months is very, very effective. Very effective, up to almost 90-something%. 98%. Very, very effective. 3 months, very effective. The other one is the vaginal ring and the contraceptive patch. All right, thank you. You're following. It's shaking. So you can see that's the injection. We give it every 3 months. They give you a date. So if you take it on June 1st, they already calculate your next appointment and they tell you straightly, don't miss that appointment. Because let me tell you, the moment you miss that appointment and you see your period or you have intercourse, the chances are as high as 80% that you will get pregnant. Forget the myth that they're telling you if you use contraceptive, you will not come, you will not get pregnant. It's a lie. I've seen it many times in the hospital. Somebody stopped injection and after 1 week, bam, oloyun. So we have the injection, and then we have the contraceptive patch. That one looks like, do you know your plaster, elastoplast? That elastoplast plaster. It's like a patch. Just put it on your arm. Are we listening? Put it on your arm, your tummy, or the buttocks. Okay? It releases those chemicals. The chemicals are stored in the patch. Releases it every week. It's done once every week for 3 weeks. And after the 3rd week, you stop so that the last week you allow you to do your to have your menstrual flow. Do you understand? It's also effective. All right? Are we following? Then the other one is the long-acting reversible contraception. Now this one we are talking about, this one is now very common. We have the IUD, the intrauterine device, the one they actually place inside. Okay? It's like T. Can we go to the other one? I don't think it's here. That's it. Can you see it now? It's looking like T. So the reason is that they have shaped it like the uterus. You know the way the uterus is? At the angle where the two tubes meet, those two ones that looks like cotton bud, they block the entrance of the tubes, okay? And the lower one protrude through the cervix. So what this one does, very effective. There are two types, the one that has a chemical and the one that has iron, which is copper. Okay, they have two different modes of action. The chemical one, of course, we said is for ovulation. It stops ovulation. So once they put it, if the sperm pass, it will not allow, because there's a blockage, it will not allow implantation. So it stops implantation and it also stops ovulation. So if you use it, because it's a chemical, that chemical will stop ovulation. Peradventure, she gets pregnant by force, there will not be implantation. The other one is the copper, because copper is a metal. Once it's in the body, it reacts with sperm. Once sperm gets there, destroys sperm. Bam. Do you understand? So these ones are very effective. They call them long-acting because they can use them for a long period of time. It can be there for a long period of time. Like up to what? Up to 9 years, 3 to 10 years. 3 to what? 10 years. Can be there. Just be releasing the hormone, JJ, and bam. And you know the beauty is that the man doesn't need to stress himself. Doesn't need to use condom. Bam. It's done. Everybody's okay. All right? But there are not side effects. Let's say disadvantages. What do you think is the disadvantage for this one? Ma? It can be displaced. Yes. The way it is now, you know it's soft. Because the way it's placed, it shouldn't be tough so that it doesn't injure internal tissues. So in the process, it can be misplaced. It can move. And when it moves, what do you think will happen? Pregnancy can happen. Ectopic pregnancy can happen. Have you heard of ectopic before? What's ectopic? I can't give anybody money for that one. Okay. So ectopic is now the one that escaped. So rather than staying, it now stays in the tube. So the chance of ectopic is higher with these ones. But the effectiveness is as high as 99%. Guarantee. Guarantee. What other disadvantage does he have? Ma? So once they lapse, you take it out, they'll put another one, they examine you, put another one in. Some people go after 8 years, some people 5 years, okay? So they take it out so that it doesn't expire. Because when it expires, then the chances that it will not work is high, okay? Another disadvantage is that, okay, it has to be placed by midwives. It's not something you can do yourself, all right? But it's very, very safe, and it's also very effective. Quite a lot of people I know are on IUDs, okay? The other one is the implant. Somebody say implant. Implant is like can we go back? There's one. It's like a rod, a small rod. They put it in the upper arm, okay? It contains that chemical too. And when they put it under, they bury it inside the skin, okay? And it stays there. Can be there for 5 years, 3 to 5 years. And it's also very, very effective. All right? Implant. Where is it now? Did I put it? Did I put it there? Put it there, put it there, put it there. Go back. Okay, it's not there. Okay, it's not there. I'll talk about spermicide later. So, Ma? No, it's not there. Implant is just like cotton wool. It's long, like a matchstick. Just put it in there. Less than, it's just like 3 inches or 4 inches long. No problem. I'll get the picture later. Then the other one I want to talk about is the permanent method. Somebody say permanent method. When we say something is permanent, what does that mean? You cannot reverse it. You know that one we said is long-acting, but you can change your mind. But this one, once you put it, the bus stop. You know the kind of people that want to go for this one, they have entered the last bus stop. Now the people women will say, I know send, make rain fall, and don't finish. Make rain, I don't finish. You know what I'm talking about? They are not interested in conceiving again. They don't want to have children anymore. So they call them sterilization techniques. So these ones are the ones where, go back to the uterus. Those 2 tubes we are talking about, I've done it so many times. In fact, within 3 seconds, 4 seconds, pim. That tube, that fallopian tube we see is very narrow, it's finger-like. What we need to do is just we tie it. We tie both sides, but because we don't want to just tie it, you know when you tie it, you are limiting it. I'm tied at that. We are not satisfied. We cut it again. We separate it so that the 2 ends don't meet. Do you know what it means? What I'm saying is that, you know when you have a rope, you tie here, you tie here. So if the sperm is coming in from here, you understand, you've tied this place. If the egg wants to pass through this place, you have tied this place. But we are not satisfied again. Sperm ile lágbára gan. You know when God said, multiply, be fruitful, God was not joking. So we took him serious. So we decided to say, okay, God, no problem. Let's cut the middle. So we now cut the middle and separate it. Cut it does not mean that we have removed anything. No. We just cut it. You know, we are tied. Patient can't bleed. Nothing can happen. But the 2 ends cannot meet. So even if by virtue, by force, by fire, they pass through that place we tied, they can't meet. And you see, this is the safest. When I say safest, when we are talking about side effects, that can there be side effect? This one, there's no side effect. Once we tie it and cut it and put it, the chances of reversibility is about 0.01, except the person did not do it well. Do you get what I'm saying now? Except the person that performed it did not do it very well. Maybe it's new. That fallopian tube, can you see it now? That fallopian, you see the fundus, at the place is coming out, just some few centimeters we tie, close to the ovary tube we tie, then in between that place I put fallopian tube, we now cut. So we separate it. No, we don't cut the fundus. I'm talking about the tube. Once it comes out from the fundus, the beginning of that first wave, we tie that place. The second part that is after that fallopian tube too, we tie it. So that fallopian tube itself will now cut it. So they separate it. No. Good question. It doesn't affect your menstrual flow. You will continue with your menstrual flow because there's estrogen. You are still releasing eggs. You'll still be feeling middle pain. Egg, bro. You'll be feeling middle pain. But it's just that the egg is complaining that I do not see any partner or yeah, womb that is forming. Because the womb will be preparing itself for pregnancy. Every time you release an egg, the womb, this uterus, will be getting bigger, producing more stuff to get pregnant. But once it doesn't see baby, it sheds. So you'll be seeing your period normally. You'll be seeing until menopause catches you. This is the safest. Ask your question. The chances a doctor will do mistake, except if it's a crack you went to meet. If it's me, you go work, mama so pani. Eh? With the what? If paraventure the baby grows, I've seen one, very few. I've seen actually one that it failed, but the chances are high that it will be an ectopic. The chances are high that it will be what? Ectopic. The pregnancy will be in the tube because it can't move. It will just stagnate in the tube. It can't go, so it's ectopic. Do you understand? All right. Did you get that? The other one is for the men. Now, this one is about 99.9%. Oh, thank you so much. God bless you, sir. That's it. That's what we are talking about. Yes. Can you see what I'm talking about? That's the tube. That place I said it's fallopian tube. That's where we cut. But you see what they did in this one? We tied both ends first, and then we cut it in the middle. So there's no way, even if the sperm escapes the first time, it will not, there's nothing to touch it to. It's just like you want to cross a bridge, and you have broken the bridge. There's no bridge to cross. You have broken the bridge. You have removed the bridge. Do you understand? Ma. Now, Oyinbo people, good question. Please clap for her. We are entering into a level of advanced technology and surgery. I've heard where they now use nanotechnology. You know nanotechnology? Where they will, because it's small, they can actually close it again. Nigeria, we are still far. That's why some people go out to study more. They can actually put it back because there's a way they will bring the two ends they can cut that part off. Because if that part is affected, they will cut that part off. The other end that is fresh, they will bring it and astomose it together and tie it. They are now doing surgery for women that are pregnant inside and putting the baby back. You don't get. A woman is 26 weeks or 28 weeks pregnant. They discover that it has a tumor on the baby at the back. They entered, opened the womb, went through the there's a sac that if you do it will burst. They had we call it nanotechnology instruments that when it will go inside that like nylon, it will not pierce it. It will pierce it, but it will not burst the water. And they will use it to bring out the tumor. And they will close back. That's science. That's human knowledge. That's God's giving knowledge. And the woman will be there after 30 weeks. They will now do surgery again and bring the baby out alive. As if the child never had any tumor. Do you understand? So it's possible, faith. But what I'm talking about is that once it's done here, because people don't have all those access to 0.01% most of the time it won't work. The only other alternative is if you do IVF. Do you know what IVF is? So that means now the woman by herself and the husband can't get pregnant again. But they can take the man's sperm, take the woman's egg, fertilize it outside. As long as the womb is still okay, they put it inside and it will grow. Do you understand? That's if they must have money. Do you understand? That's emergency. Then there's the last one. Your question. That banded clip type.
Yes.
That,
can it be a means of like temporary contraception?
For this one?
Yes, like you tie it, then if the person is ready.
Yes, it's like a ring. They put it like a ring. They fold, let's say this is a tube. They fold the tube like this. We lift it up. How many of you know ribbons? Your rubber band. I use your rubber band to just tie it like a clip. Or use like a clip and leave it there for a while. And then when you are ready, you can remove it again. It's possible. Yes, ma'am. You can do it through C-section. Majority are done through C-section. But there are some that are not done through C-section. Maybe after C-section, we can also do it as an in-office practice. But you need to use monitors. You need to use, what's it called? A stereoscope. As in, you apply, monitors to a camera. So you'll be seeing it while you are going in. Through the vagina, yes. They go through the vagina. The woman lies down. They give her some of sedative. They go through the vagina. The posterior furnace, they go in. But it's guided. They have a monitor, a camera that goes in that they will be using to see because you can't see. So the man goes in. They will see it through the camera and they will just tie. That's all.
Doctor, someone has a question, but she has it written.
Yes, let's have it.
The first question is, what causes pain during one's period? You feel serious pain while urinating and pooping. You feel during and after each bathroom visit. All this only happens during the menstrual cycle. That's
pain when menstruating.
Yes, serious pain.
And then you're also having frequent urinary symptoms.
Yes.
You know, I did mention that there are a lot of gynecological conditions that happen, especially during menstrual flow. One of them can be uterine fibroids. How many of you have had fibroids before? I've seen a woman who had fibroid big enough to be qualified as a pregnancy of up to 8 months. You know, we term the size of fibroids as if it's a pregnancy. So the fibroid was so big that it now started sitting on the organs, the adjoining organs. The rectum is quite behind, the bladder is in front. So it's now sitting on the bladder. So she's always having pain when urinating, you understand? And fibroid itself can cause pain. How many of you know? Their menstrual pain is usually difficult than others because if there's a submucous type, there's a particular location of a fibroid that causes intense pain. So when they're having menstrual pain, they're having their menstrual flow, it's usually heavy, it's usually painful, and they can be surrounding contiguous pressure effect, which can cause pain. So that can be one of it. The other things that it could also be is urinary tract infection. If a woman has UTI, maybe the infection has spread through the urethra, the urinary tract, and then it's having all those burning sensations. She just needs to see a gynae doctor to evaluate her. All right. Thank you so
Very much, sir. So there's another question.
Okay.
So why is it that you gain more weight and you have irregular menstrual cycle while taking contraceptive drugs?
No, say that again. Sorry.
Why is it that you gain more weight and you have irregular menstrual cycle while taking contraceptives drugs?
Thank you. So it's one of the things I wrote down in the myths, and that one has been answered already. Now, a lot of people say that they don't like taking contraceptive because it causes weight gain. Now, the way I will answer this is that, yes, there is a transient weight gain, and that weight gain is just retention of water. It retains more water. But in the actual sense, it is not the one that is actually responsible for the weight gain. It's just water, increase in water. A lot of people have started using contraceptive pills now. I've seen a lot of young girls that say they take contraceptive pills to add weight, to increase their size, to increase certain area. And, I've had people come and say, doctor, on shishe. Well, it will work because there are certain hormones that when you use them for a while, okay, apart from the weight retention, they begin to interfere with your menstrual cycle. I've seen a lot of people that have used contraception also to stop acne. You know what acne is? When you're having breakouts. Breakouts? Yeah, it works because that's one of the advantages of contraceptives. Okay, they use it, they have less acne. Because what the contraceptive is doing is that it's giving you the hormones that your body normally produces. But because your body is not producing a regular way, the hormone is regular and consistent. So it'll be giving it to you gradually. So your body can rest and produce at its rate. But why is contributing more? So it will be giving you that full effect of estrogen, which gives the woman the normal glow. You don't know estrogen is what's giving you the glow. It's the estrogen that gives you that glow. So that acne breakout will go. You understand? The irregular menstrual flow too becomes regular. You understand? Not irregular. It makes you have lighter bleeds. Lighter what? Bleeds. So when a woman comes and say, my period is irregular, I'm saying it, see, one of the things we actually give you are those contraceptives. Ma?
Who have PCOS?
Some we do. Because some of them, their periods are regular. And we need to regularize their period before we start treating them for fertility. Ma?
Yes, sir. Doctor. Can women in menopause that are already in menopause still get pregnant or produce eggs?
Ẹ pàtẹ́wọ́ fún wọn. Ẹ pàtẹ́wọ́ fún wọn. I like that kind of question. So, I've asked a woman. There was a woman that came 3 weeks ago, and she's 55 years old. I'm not laughing because she may be watching if it's projected live. These are things that we learn from. She's 55 years old. She has a kind of a swelling. She has registered for antenatal already. She said she's about 19 weeks or 20 weeks. By that, I mean she's about close to 5 months pregnant. She's done her antenatal and everything. And the booking clinic, the day she came for her booking, my doctor saw. And when he saw and saw the, the condition, he had to bring her to me. That, Oga Supervisor, this is your case, sir. And I said, what's the problem? She said she's 55 years old. She has done the antenatal, and she's allegedly pregnant. He was very careful because the woman was there. There's some people that they are educated so that you don't insult our intelligence. That she's allegedly pregnant, but the first test she did, she said it was positive, but the other one she did was negative. So I told him, no problem, I'll take it up from there. And I asked her, I just chatted with her, we talked about, I wanted to have a background of what has been happening with her. So she's faith-based. At the end of the day, what happened? She said she's pregnant. I said, yeah, how did you know? She said she did a test. I said, can I see the test? She showed me the test. It was positive. I said, okay, can you allow us to do ours here? She said, no problem. So he said, is there any problem, doctor? I said, there's no problem. We just want to be sure. So we ran our test, and our test came out negative. Of course, Because we've done it before, we knew. So it was negative. And I called her in the office and I told them the test is out. I said, what is it? He said, it's negative, ma. He said, hi. What does that mean? She's having tummy, swelling. She's feeling lightheaded. She's feeling her breast is, is full. She goes to the toilet more often. She vomits. She has nausea. She's telling me all the presumptive features of pregnancy. Okay? And I listened to her. And at the end of the day, I said, yes, ma, all those things are there. We don't deny them. But the essence of why we are here is for us to have conclusive tests. And the conclusive test we did says it's negative. Can we do a scan? We said, okay. We did another scan. And the scan came out to say nothing. At least with 5 months, it will be obvious that you see a living heartbeat and everything. And I called her and I said, there's no pregnancy here. He said, since when? He said, because she heard and she was told that. Now, to answer your question, ma, the woman had to go. She now said she has paid for everything for 9 months. I said, ma, when can she come back again for a new one? I didn't argue with her. I said, look, until this, your 9 months period pass, and we are sure that this phase has gone, you can now come back when you get pregnant again. And she said, no problem, and she left. I didn't sit her down to say she's paranoid. I didn't argue with her that she's delusional, okay? She told me in plain terms that God told her she heard, and I will not go against her faith. And rather I told her, yes, but after another 6 months, come back. If it's like that, don't back or no. I'm here to confirm what God has done. And we didn't argue again. She left. Now, a 55-year-old woman can get pregnant. And a 55-year-old woman who is into menopause may not get pregnant. Scientifically, once you go into menopause is a fixed state where your eggs no longer produce estrogen. All right? And when your eggs don't produce estrogen anymore, you understand, all the bodily features, the physical, the psychomotor, the cardiovascular, every feature that estrogen touches a woman in is being receded. If I'm going to explain that in light, you'll understand. And one of the places that it affects is the womb. You understand? She doesn't see her period again. Once a woman doesn't see her period consecutively for 12 months, that's menopause. It gives you sign 4 years or 5 years before. Okay? It's giving you sign. It may be light, it may be heavy, it may be soft, it may not come. Can give you any feature. Yes, or it may be more. It may be light, or it stops. Because we have what we call hormone replacement therapy. What's hormone replacement therapy? Women who have gone into menopause, they're not producing, they're not seeing their period and everything, but we are giving them, we are injecting